Facing criticism over Ontario's new COVID controls, Premier Doug Ford hit back.
Folks, there is no confusion here. It's very simple. Stay home.
Ontario's stay-at-home order lists nearly 30 activities it deems essential, including grocery shopping, dog walking, and accessing healthcare. But it's also giving people some wiggle room.
I know that essential means different things to different people. We have 15 million people in Ontario, each with their own individual circumstances. So we need everyone to use their best judgment.
As cases climb and fears mount, the province has muddled the message, says Noah Zahn.
And I don't know a single person today who isn't very confused, and that confusion leads to fatigue.
Up to 5 people can still gather outside. Travel within the province isn't recommended, but it's not prohibited. Non-essential businesses are still open for curbside pickup, and local authorities spent the day waiting for clarity.
We don't know. So literally the best information we have right now comes off a media release and a slide deck.
Fines of $750 can be issued to residents ignoring the order, but it's unclear how it will be enforced.
Mourning the deaths of our loved ones.
There's anger, too, that Ontario is not ensuring paid sick leave, a measure mandated in just 2 provinces, Quebec and PEI.
If we had adequate supports, there would not be as many outbreaks right now because people would have the ability to stay at home.
The new measures take effect tomorrow as Ontario's healthcare system teeters on the brink of collapse.
If this thing is not controlled, God forbid if you get into a car accident or if a relative has a heart attack, there's going to be no room for them the way things are going.
That means the push to stop the spread couldn't be more pressing. Ellen Morrow, CBC News, Toronto.
Okay, now I want to show you some of the latest data that we have in Quebec because this is a province where for months we've seen this steady climb in COVID cases. The red line is the 7-day average, but as you can see in the last few days worth of numbers, we have what looks like the beginning of a turnaround. So let's sort through this with Dr. Christopher Labos, an epidemiologist in Montreal. And I would like to start, if I could, with what you make of those numbers. Are they a good sign? And if so, what's working exactly?
Well, they're a good sign in the sense that the numbers aren't going up. So clearly, we're not seeing the post-holiday surge that I think a lot of us were worried about, that we were expecting to see in mid-January. So in that sense, it's good news. Whether the numbers continue to go down, whether this is just a statistical blip or whether this is real, still a little too soon to say. We'll know over the next few days. If the trend continues and the cases continue to go down, then that's obviously good news, and it means that the lockdown is actually starting to work.
Right, and is that the key? Because, I mean, we've seen some provinces showing some positive progress, I think out west, and then other provinces like Ontario and Saskatchewan that are at a crossroads. Like, what's the takeaway here?
I think the takeaway, the final common path is that if you get people to stay home, whether a lockdown or a curfew or whatever mechanism you put in place, if you get people to stay home, less people get sick. If less people get sick, less people end up in hospital. It really is as straightforward as that. And, you know, these are hard measures to put in place. You have to enforce them. But if you put them in place early and if you have proper enforcement, the number of cases will go down eventually.
Dr. Labos, thanks for your time.
My pleasure. Take care. Stay safe.